Bismillahirrahmanirrahim. Assalamu alaikum. My name is Fiz Ahmed. Today, my topic is the arteries and veins of the posterior triangle. In my previous video, I have explained about the nerves and the muscle and boundaries of the posterior triangle. So, there are four arteries present within the triangle. The first one is the third part of the subclavian artery, then the suprascapular artery and the transverse cervical artery. These arteries are the branches of the subclavian artery and the occipital artery. Now I will explain about the veins. Basically, the important and largest vein is the external jugular vein, and the branches of external jugular vein are suprascapular and transverse cervical veins, and the subclavian vein. External jugular drain into subclavian vein, and these three veins are accompanied by the respective arteries in the triangle. Now I will explain about the origin and the branches of the arteries and the veins. So I will first explain about the arteries of posterior triangle. So they the first one is the origin of the subclavian artery. So here is the arch of the aorta, and from the arch of aorta arise the left and right internal carotid artery. Basically, there are two internal carotid artery, the left and the right internal carotid artery, and above the right internal carotid artery is the presence of the brachiocephalic trunk, and the left subclavian artery arise directly from the aorta, and there are further four branches of the left subclavian artery. So the first branch is the internal thoracic artery. The second one is the costocervical trunk, and the third branch of subclavian is the thyrocervical trunk, and it is present in the posterior triangle. And fourth one is the vertebral artery. And the right subclavian artery arises from the brachiocephalic trunk, and there are also four branches of the right subclavian artery as well. So now I will explain about the arteries which are included in the thyrocervical trunk. The first one is the inferior thyroid artery, then the transverse cervical artery, and the third one is the suprascapular artery. And transverse cervical and suprascapular are present within the posterior triangle of the neck. And the arteries in the costocervical trunk are the deep cervical artery and the costal arteries. So here we are done with the arteries of the posterior triangle. Now I will explain that how the subclavian artery divided into the three parts. So here is the manubrium sterni, sternum, and anterior to the sternum is the arch of aorta, and from the sternum arise the first rib. From the arch of aorta, as I have explained just a minute ago, that arise the internal carotid artery, and the left subclavian artery arise directly from arch of aorta, and right subclavian artery arise from the brachiocephalic trunk. So the muscle known as the anterior scalenus muscle divide the subclavian artery into the three parts. The part which is medial to the muscle is the first part, behind the muscle is the second part, and lateral to the muscle is the third part. And the axillary artery is the continuation of the subclavian artery in the axilla. So now I will explain about the veins of the posterior triangle. And the important vein is the external jugular vein, and it arises by the coalescence of the two veins. This is the posterior auricular vein, and the second one is the retromandibular vein at the level of the mandible below the parotid gland, and it give rise to external jugular vein, which drain into the subclavian vein, which is also present in the posterior triangle. And therefore the two branches of the external jugular vein, suprascapular and transverse cervical veins. And here we are done with the veins of posterior triangle. Thank you.